Hello, everyone, and welcome to another audio podcast on this series relating the molecular storm gauge V.2. This is the Shientist, and this is another Storm Robotics production. And today, I'm going to give an overview on another excuse me, another collaborative effort relating to understanding healthcare education, and it's all about the numbers game. So this work is relating to some research that was done between two academic institutions two academic institutions and the Renal Patient Support Group, or the RPSG, and there was involvement in relating to the Kidney Disease and Renal Support Group, or KDARS for kids as well. And excuse me. And in line with this work has actually been put in for peer review. My understanding is, this audio podcast, I'm just going to provide an overview by reading the abstract around this work, and it is the manuscript of this work has been titled as Integrating Healthcare Education for Best Practice, and it's looking at this particular topic from a quantitative or numerical point, a numerical standpoint, a numerical perspective. I'm going to start off by reading, providing an overview relating to the introduction. So online spaces, or technology, or sort of digital digital working have allowed patients with particular long-term health conditions to access information through online spaces, websites, portals, and patient-centered organizations. The aims and objectives around this work was actually relating to where the team involved looked to conduct or conducted by conducting a retrospective, what's referred to as a retrospective pilot, descriptive analysis of topics and educational efforts between two online social media platforms. This research, or this work, looked to seek to sort understanding of what requirements healthcare education and what requirements and healthcare education needs there are to be are required for CKD patients, for those going through chronic kidney disease. And this work, like other research, other works, the understanding is that it went through an ethics application process, and the research couldn't go forward without an ethics application process, and this was linked to so whilst this work, my understanding is that is work that is linked, that has first and foremost has a quantitative or numerical perspective, and there was research that in the last audio podcast, in this particular series, I mentioned a research that related to qualitative work. Now, this work was linked to that work, and therefore had, my understanding, that it had the same, it went under the same ethics application process as did the qualitative research. So in this regard, GDPR, or General Data Protection Regulation 2018 guidelines, were also implemented to ensure best practice, and the research protocol, there was a research protocol around this, and the ethics application process itself was approved by the Greater Manchester South Research Ethics Committee, and this work had the same ID information, or project ID information, relating to that ethics application. This work actually, my understanding is that it stemmed the qualitative research stemmed from this work. So this work actually started out initially, and basically by implementing, as I understand, is some of the work around and getting some sort of baseline understanding around topics that are pertinent to those going through this healthcare, going through this, going through aspects that align to educational support and chronic kidney disease. The qualitative research followed on from this work. So generally speaking, they had both gone through ethics application, the ethics application process. So the methodology around this is that between two research social media platforms, or two social media platforms, i.e. the Renal Patient Support Group, or the RPSG, and the Kidney Disease and Renal Support Group for Kids, or KDAR for Kids, educational topics were tagged and applied. So that was part of this work. And then participants were then invited to complete a survey, and participants who were approached, who were sort of encouraged to complete the survey, or these surveys, were those who had were from those who had health professional backgrounds, i.e. allied health professionals, and also those who were going through chronic kidney disease as well. So what happened is, as part of this, a URL, or a link relating to two surveys. It was more or less the same survey, but one was for health professionals or allied health professionals, and one was for patients. And basically, a link or URL was actually posted onto the Renal Patient Support Group, the RPSG, and primarily the work was led by the RPSG team and colleagues over the time during this work. And the results around a part of this as well was that what it was, there was the URL led to another page being opened, or a link that was posted on the RPSG relating to this research, was then posted, allowed participants to complete the survey by clicking into a link. And then what happened, this also was where part of the ethics application, obviously there are various software packages out there that pretty much anyone can use to provide are used to collect data from a quantitative or numerical standpoint. But this particular research used a software called Qualtrics, and Qualtrics is basically the only software from an academic standpoint that can be implemented and has sort of validity from a academic and research standpoint. So what happened is that as part of this, Qualtrics software was used to describe and analyze data, and 19 surveys were completed by allied health professionals professionals, and 45 were completed by those who were going through chronic kidney disease, and mainly those who were in the adult population going through chronic kidney disease, and not so much those who were young people or pediatrics or young people going through kidney disease. So I'm going to now highlight a bit about the results, and then I'm going to talk a little bit about some of the things around sort of the things around the discussion and conclusion as well. So the results around with this inform that the highest responses from allied health professionals, according to gender, were female versus male. So 57%, just over 57% from the female background participated in this survey from allied health professionals perspective, versus males, which were just over 42%. And then relating to chronic kidney disease patients, 55% from female backgrounds contributed to completing this survey, and versus males, just under 40%. It was 38.89% who from those with chronic kidney disease and from a male background who completed this survey. And the types of allied health professionals who contributed were healthcare scientists, nephrologists or clinicians, other allied health professionals. Now in the survey, there was the allied health professionals. Whilst there are a number of whilst there are a number of allied health professionals, those were not listed in the survey in their entirety. Therefore, allied health professionals on its own was a selection that participants could actually select as part of completing this survey. So that was where allied health professionals was concerned. 17.65 or nearly 18% completed participated. GPs or primary care physicians was just under 6%, so 5.88%, and patients cohorts included those who were transplant patients, just over 60%, hemodialysis patients, just over 13%, nearly 14%, and chronic kidney disease patients that were in the category of stages 3 to 5, CKD stages 3 to 5, around 11, almost 11%, 10.53%. So the discussion around this highlighted that online educational modules should be or could be co-developed and linked to a chronic kidney disease educational pathway. Now, the overall conclusion around this is that this was or is the first international retrospective study that examines relevant educational gaps between allied health professionals and two chronic kidney disease populations. And I am going to highlight a bit about the so the full manuscript has as my understanding is that it has been put forward to a particular journal, and it considers lots of other aspects to this research, including including some of the limitations. But I can highlight a little bit around the limitations around this particular work, and that is that one of the limitations of this investigation relates to the number of survey responses from both healthcare professionals and those going through chronic kidney disease. Respondents from patient cohort had demographics with varying ethnicity, age range, and gender representation. Respondents from health professional cohorts were predominantly from white backgrounds, higher education status, and primarily female also. Again, those from allied health professionals, health professional backgrounds that contributed included again healthcare scientists, nephrologists or clinicians, allied health professionals, primary care physicians, and patients. Patient cohorts included transplant patients, hemodialysis patients, and those going through chronic kidney disease stages 3 to 5. Now, there are, though there is limitation regarding the generalizability of the pilot data that has been collected through this particular research, greater use of what was identified through the data more collectively, like for example, looking at the data in a more robust way through altogether. Greater use of skill mix will be or can be more important if health professionals and patients want to see best practice beyond the confines and constraints of traditional consultations. Now, the aim should be to equip allied health professionals and patients with education and knowledge base to ensure there are mutual objectives between service users and providers. Thus, to also ensure education stems at the very heart or the basis of kidney care practice or nephrology. The effort therefore should envisage collaborations or integrative efforts between healthcare sectors by patients and professionals having mutual goals, and where there is mutual thinking or even joined up thinking, and therefore in future there should be again as mentioned in part of the abstract, educational modules that are co-developed between health professionals and patients could stand to actually help build better efforts. I'm just gonna highlight a little bit more here. Co-developing educational modules involving patients and professionals would prompt more joined up care in meeting educational needs and addressing health inefficiencies. There is an important investigation that could important investigation, that could potentially inform clinical management. So I'm going to leave it at that. I'll leave it there. This has been an audio podcast relating understanding healthcare education, and it's all about the numbers game. And this is the molecular storm gauge, a V.2. This is the Shientist, and it's been another Ztorm Logistics production. I want to say thank you for listening, and hopefully there'll be another audio podcast on a related topic in a subsequent edition. Thanks for listening. Take care.